All right, so let's look at the conduction system of the heart. Conduction. Okay, so just to orient, this is the heart. All right, this is a cross section of the heart. This is the right atrium, right ventricle, left ventricle, interventricular septum, and then these are the walls of the ventricles here. So those autorhythmic cells are located in specific areas. And the main area that they will be at is in the right atrium. So this little thing here, this little nodule right here, which is in the right atrium, this thing is called the SA node. Or also called the sinoatrial node. And this guy is the pacemaker of the heart. So basically, these are autorhythmic cells here that when they depolarize, they pass their action potential to their neighboring contractile cells. And what will happen is this action potential starting at the SA node will travel throughout both atria. So that's what these arrows are signifying here. So it's going to depolarize all the contractile cells in the atria first. Once the atria are contracting and completing their contraction there, because remember, blood is flowing from atria to ventricle, and we need to make sure that all the blood gets from atria to ventricle. So we make sure through the atrial contraction that all the blood makes it through that AV valve. Okay, so once that occurs, then the action potential then travels to this node. So this node, get some color here. So this node here is called the AV node. Or the atrioventricular node. And once it gets to the AV node will hold on to that action potential for a moment. It will delay it. Okay, so it holds the action potential. Okay, and it's basically doing that because the heart needs to make sure that all the blood is getting pushed into the ventricle before the ventricle starts to contract. So the action potential then travels towards the septum, so the interventricular septum, and at the interventricular septum is this AV bundle. It's also called the bundle of His. So the AV bundle basically stretches from here to here. It's hard to draw this because it looks like this ventricle is separate from this septum, and it's not. It's not, you know, it's just showing where this vessel is going to, where the pulmonary trunk comes out, but it's sort of a skewed view here. But all of this is the bundle here. And once the action potential gets to the bundle, it will split. It will split into right and left bundle branches. So that's here and here. So it splits. And those branches come down. They travel down the interventricular septum. These two branches here. And then the right one goes toward the right ventricle, the wall here of the right ventricle, and the left side goes to the left wall of the left ventricle. And these little things are called Purkinje fibers. And these are what stimulate or depolarize the contractile, all these muscle cells get stimulated and contract. Okay, so when the contraction occurs, it is going this way towards should I say the electrical part of it is running in that direction. So it's going this way to the tip and then up the sides. Sorry, this looks confusing. Okay, so the muscles, the atrial muscles contract first and they push the blood from atria to ventricle, and then these muscles go, but then the main contraction comes from these walls, where the contraction then is going this way, which works because the blood is going up through the pulmonary trunk, up through the aorta, or into the aorta. Let's see, anything else with that? So that is the basically the conduction system. Starts with the SA node. The SA node is the pacemaker, and the pacemaker is about 90 beats per minute. Okay, so there's some autonomic nervous system going on in there in order to bring that resting heart rate down. If we didn't have the other parts of the nervous system, then our resting heart rate would be at about 90 beats per minute, and a resting heart rate is normally about 70 beats per minute. So we'll talk about heart rate in the next video, about how that happens.